announce that we do have an association plan for the WFDA again. It's been a very long time coming, and it is definitely an association benefit that we want to extend to you. So let's get into it and I'll explain the plan and some of the information in our webinar here. If you have questions, again, put them in the chat and I'd be more than happy to answer any of those for you. So again, my name is Christine Nadowski. I am the benefits lead, department lead, and old picture, I apologize for that, but let's get right on into it. So the agenda for today, we're going to actually overview the plan types and the common terms associated with that, the association health plan versus individual options, our plan designs that we have, benefits of the plan, value adds, and then how you get a quote. So let's begin. The plan types that we have for our association health plan, there's two different types of plans. We have a copay plan, which is more of a traditional type plan. A lot of people are used to that. You go to the doctor, you get a $25 copay for a primary care visit. And then for specialists, anyone who has an IST behind their name or their title, that would be a $50 copay. Now, these plans, because they have the first dollar benefit of those copays built into the plan, they tend to have a little bit higher premium because you're getting benefits before that deductible's already been satisfied. The other plan that we have, they used to call it in HSA, which they changed it to a high deductible health plan. And it actually is just that. It's a high deductible health plan that you must meet before your insurance will start paying its share of office visits, lab tests, and prescriptions. Premiums do vary, but we refer to them as HDHP. So if you hear that, that is exactly what I'm referring to as a high deductible health plan. They tend to be more cost efficient. These type of plans are wonderful for people who want to set up a health savings account on the side, people who don't doctor too much because they are a higher deductible plan and everything goes to the deductible and the co-insurance. Keep in mind that preventative care with both of these plans, if you're in network, will be covered at 100%. So you don't have to worry about when you go in for your annual physical that you're going to have to pay anything. So those are the two different types of plans. Again, prices do vary with these plans and plan options. Some of the terms that you're going to want to kind of keep in mind is, and we always refer deductible and co-insurance. Deductible, co-insurance, a lot of people are like, what exactly does this mean? What is this deductible? The deductible is actually how much you pay for your health insurance before the plan covers a larger portion of your bills. Deductibles do reset yearly on January 1st. Even if you have a plan that renews, say, August 1st, your plan deductible will actually reset on January 1st. Co-insurance is a percentage of medical charge that you are responsible for with the rest of the amount being paid by your health insurance plan. That typically applies after your deductible has been met. On our plans for the association, we have a 20% co-insurance, and then we also have a 100% co-insurance. We wanted to keep it simple, so then that way you knew exactly what your co-insurance was. There's so many plans on the Affordable Care Act that are 50% or 30% or 20%. And after a while, that does get kind of confusing. So we wanted to make it nice and simple for you so you knew exactly what your out-of-pocket would be. Now, we get asked a lot of times, well, how does the association plan differ from the individual health insurance? First of all, with the association plan, your employer is going to purchase this plan. It is a true group product. So your employer is responsible for initiating this type of coverage. Individual and family plans, of course, the employee or the individual needs to seek out that information, compare quotes, decide sometimes blindly on what is going to be the best option for your family needs or for your individual needs. A huge part of the association plan is your network size. Your network will vary from statewide to national, depending on the plan that you take. We do have WPS Health Insurance, which has the statewide network, and then which actually encompasses about 98% of all providers within Wisconsin. There's also WPS Health Plans. Now, this used to be Arise Health, and WPS renamed it. This is a little bit of a narrower network. It's not, WPS Health Plan is not available in all areas because of provider network availability. So if you go with that type of plan, you will have a great network provider, but unfortunately, it doesn't expand to a lot of the Wisconsin area unless you're in that region. Your network size with your individual and family plans is limited to your regional area. That's why when we do quote the individual plans, we always ask, well, what is your zip code and what is your county? Because that will determine where you can actually get your coverage. Providers don't cross different regional areas, and sometimes that can cause a problem, especially if you have someone in college. Like with myself, I had my son in Whitewater and I had to get him his own individual plan because the individual plans that are up in Milwaukee here don't reach down into Whitewater. Out of network coverage. Oh, and I do want to go back to the network for 1 minute. With both the WPS Health Plan and health insurance, there is out-of-state network providers through First Health or through Preferred One. So you will have out-of-network coverage if you're traveling throughout the state, which is wonderful. First Health is a huge network that is nationwide. Your Preferred One network will be in Minnesota, South Dakota, and North Dakota. That's very important because on individual products, they do not have that type of coverage. All right, so then that gets us to out-of-network coverage. Based on your plan underneath the association, your employer is going to select the plan or plans, because you can have up to 4 within a group as long as we have a heartbeat in each plan. Most groups, group plans tend to have some type of out-of-network coverage or limit. So your individual deductible might be $2,500. On some plans, that would be a $2,500 out-of-network deductible as well. Now, they do not commingle, so you would have separate deductibles for in and out of network. And again, like I had mentioned, individual family health insurance, most plans do not have out-of-network coverage. And if you go to a doctor that's outside of your network, what happens is if it's not an emergent or an emergency situation, it's going to be all out of pocket. There's no limit on what they can charge you for those out of pocket expenses. Emergency situations, like I said, will need to be coded as an emergency to be considered in network on individual health plans. This is a huge one because the enrollment timeframe, because we are actually coming up on the deadline for individual health enrollment. So individual health, you can only apply during your annual open enrollment time, which is November 1st through December 15th, or if you experience a qualifying life event, say you lost coverage involuntarily, or a divorce situation, or you were married, you had a baby. Those type of things are actually qualifying events that will put you into a special enrollment period. You will need to apply within 60 days of that event happening, and then also supply the insurance carrier a letter of credible coverage from the carrier that you used to have, within 30 days of submitting your application. Otherwise, you will not be insured by that carrier. So those deadlines are pretty strict on that, and it comes in on the 16th of December, they will not take it. Enrollment timeframe on the group side, you can establish a group at any time during the year. So that is huge. Most people try to jam everything in fourth quarter, and you're going crazy, and the carriers are going crazy, and underwriting time is a little bit longer. If your current plan renews March 1st, let's look at a March 1st effective date. We can do this, and that's what's great about looking at the association plan, because there's no time limits on when you can actually apply. Now, contribution amounts. When we created this plan with WPS, we had a lot of input on how we wanted to have this set up. So on your individual health plans, you're the one who's going to be contributing. There's no tax benefits, as it says in the next column. No tax benefits to you. It cannot be pre-taxed. For employer contributions on the association health plan, we set it at 0% to 100%. So it can be the employer only if they do 100% contribution. It could be a combination of the two with pre-tax payroll deductions, or the employer can say, you know what, I'm offering this plan, but you're paying it 100%. And we do have groups like that actually work like that. Now, on the Affordable Care Act plans, you have to have a minimum of 50% of the single employee premium. And we know with small businesses, that can be kind of difficult. We hear it every day. That's why we took that contribution requirement out and left it up to the employer. Again, your tax benefits for the association plan, you can have pre-tax deduction from your payroll. With individual plans, it's post-tax. So there is no pre-tax, there's no benefit, you're just paying your premium. Now the rating on our association plan is actually composite or blended rating, which benefits older employees. Individual plans or Affordable Care Act plans are determined by age, gender, zip code, and tobacco usage. There's no discounts at all. And mentioning the rating, WPS just had a major price reduction. So if you haven't received a quote from us, please, request one, because the rates did come down. I mean, they can be anywhere from 7 to 50%, depending on where you are, what plan that you take, and what type of carrier, either WPS Health Insurance or WPS Health Plan. So if you received a quote from us prior to 11/15, request a new quote, because those premiums will go down. The cost of coverage for the employee. Usually it's less on an employer-based plan because the employer tends to contribute something towards your premium cost. It may not be 50%. Maybe they give you a stipend of $200 a month. So that actually cuts down your premium quite a bit, which is nice. You have a little bit more take home. Normally on the individual plans, they are normally more because there are no employer contributions. Premium is paid solely by the insured. So it can be kind of tight, from month to month when we're looking at rating by age, and say for myself, you know, being 54, looking at what the rate for myself would be on an individual plan, I want to say it's probably about 8 to 9, maybe even $1,000 because of my age. But when we're looking at composite rating, what that does, it takes all of your employees that are on that census that we're quoting, and it blends them all together. So you have a rate for an employee, a rate for limited family, which includes husband and wife, partner, an employee and child, or employee and children. So those are the components for a limited family. And of course, full family is 2 parental units. And it doesn't matter if you have 1 or 10 children, you will still be rated as a family. Now, where do you get this plan? The Association Health Plan is exclusively through our agency, Professional Insurance Programs. We are so happy to bring this to the WFDA, and definitely it's something that we've been quoting out quite a bit, and we really want to establish a great block of business for you. On the individual and family health insurance, you can go privately through an agency, or preferably through us. If you qualify for a tax credit or a subsidy, then we do suggest that you go through the marketplace for that through healthcare.gov, because you'll be able to have that tax premium credit applied to your premium. Now, Professional Insurance Programs does not work on the marketplace. We do offer very similar plans, and quite frankly, almost the same type of plans. They may have some tweaks on the healthcare.gov, but we are able to offer that privately off of the exchange for you. If you've ever had a group plan, sometimes you get your renewal and you had a $2,500 deductible with a $5,000 max out of pocket, and your co-pays were set at different amounts. With most individual health plans and ACA, Affordable Care Act compliant plans, those can definitely change. Carriers reevaluate their plan options every year. They get rid of the plans that aren't as popular, tweak the ones that are popular. So you can see maybe your deductible goes up to 25 from the $2,500, maybe it goes up to $3,500 because that $2,500 plan isn't as popular anymore. So they discontinued it and they mapped you to a new plan. Out of pockets limits will go up every year as well. Those are regulated by the government. So I believe the max out of pocket right now on individual plans, some of them are $8,700. So that's a lot of pocket change when you're looking at it. On our plans, the plans will stay the same unless the employer initiates a change at renewal. So if you go with a plan with us, again, I always use the $2,500 deductible, just kind of rolls out. If you have a $2,500, say it's a high deductible health plan, and you say, well, you know what, I'm not really utilizing this coverage when you come up to renewal. Let's bump it up to a $5,000 deductible. That will only happen if you, the employers, initiate it. So that's kind of a nice tweak as well. Emergency room coverage. Now, on our association health plan, we do have an enhanced emergency room coverage benefit with WPS copay plans. It's a $300 copay, then co-insurance. Your deductible is waived. On most individual and family health plans, your emergency room copays may vary depending on your plan. And this is true also for the Affordable Care Act. I'm just going to call it ACA plans. Just so if I say that you can reference that. But a lot of times that deductible and co-insurance may apply if you're not admitted to the hospital. I've seen anywhere from $300 $500, $700 on some of the ACA group plans that I've quoted out for that emergency room copay. We also have extended X-ray and lab work on the association group plan. So the WPS copay plan, the deductible again is waived, and these services are subject to your co-insurance. And again, I'm speaking of the 20% where you are responsible for 20% and the carrier would pay 80% of the charge. Not applicable for 100% co-insurance plan. On the individual health and family health is applied to the deductible and or the co-insurance. Again, it depends on that plan design that you choose. We have a fantastic feature that all of our clients will actually receive free of charge. You do need to be a professional insurance programs client in order to receive this benefit. We have an HR compliance company called Mineral. It takes the guesswork out of HR and it empowers you to do right by your employees. This innovative platform is a one-stop resource for small businesses because we know not a lot of small businesses actually have an HR person. Sometimes it's the owner, sometimes it's the owner's wife or the owner's husband, or one of the front desk people that are doing the HR. And there's a lot of things that can come up and you question it. Is this right? Am I in compliance? Mineral will actually help you with that. So it helps to fill the platform is filled with everything you need to tackle the trickiest workplace issues with total confidence. And again, it's free for our PIP clients. I cannot express that enough. On individual health plans, you don't have that. You're on your own. Now, the plan designs for the association group health plan are listed here on the screen. We have 5 copay plans. They start at a $750 deductible and go up to a $5,000 deductible. And again, the $5,000 deductible, we have a choice of 100% co-insurance or the 20% co-insurance. These plans will have a $25 copay for a primary care visit and a $50 copay for specialists. Your HSA qualified or high deductible health plans, or HDHP plans, we have so many acronyms, start at a $2,500 deductible and then go to $6,550. I do want to point out when we're looking at the plans and literature that we send over in the proposals, they're all going to list your individual deductible. Your family deductible is 2 times that individual deductible shown. Also with the max out of pocket, it's going to be 2 times what is shown on your proposals. Now, with the high deductible health plans, there's an asterisk by the $2,500 deductible choices. These are non-embedded deductibles. So if an employee has family coverage, and that's only when it would actually come into play, the family deductible of $5,000 must be met before the plan pays any benefits. And with the $5,000 deductible and the $6,550 deductible, if you're a family unit, one insured will have a $5,000 or a $6,550 deductible. The rest of the family would have another combined $5,000 or $6,550. The reason this is the way it is because if we did a $10,000 family deductible and said, nope, you have to meet the $10,000 deductible before any of your plan pays, that's a lot of money. So with the $2,500, $5,000 deductible is a little bit more reachable, especially if you have a surgery scheduled. There was an accident that happened and you have to go in and have a leg cast because you broke a leg slipping on the ice. So it really makes a lot of sense when you think about it, that yes, I only have to satisfy 5,000 rather than a $10,000 deductible. Benefits of the plan. Plan selections. Again, like I mentioned earlier, you can select up to 4 different options, either within WPS Health Insurance or, if available, WPS Health Plan. So if you have more than 4 employees or 4 employees, and one says, I only go in for my preventative services. I don't need anything else. I'm never sick, knock on wood. Um, an HSA plan or high deductible health plan might be the best suited for that individual, because again, preventative services are going to be covered at a 100% if you're in network. Somebody who likes to know exactly what they're going to pay when they go to the doctor's office might like a copay plan. I used to be avid. I'm copay plan. I want a copay plan because I want to know exactly what I'm going to pay when I go in. $25, here you go out, and then I was done. But your high deductible health plans will definitely save you some money. And if you're relatively savvy about it, you can put that money into a side account, an HSA account, and definitely check with your financial institution to see if they are able to offer a HSA account, and double check any type of fees as well. You shouldn't have fees for your HSA account, but some carriers or some financial institutions do have that. You can put money away into that HSA account every month, and if you don't use it, you know what? It rolls over to the next year. So you have money already set in your account, probably to cover your deductible, and then you can continue to put money into it. So it's almost like a forced savings, which is really nice. Employer contributions. Again, the employer has the option to elect the contribution level for its employees, if at all. This gives the employer more freedom. We do suggest at least 50% of the single premium, but that is not a requirement on these plans. Full-time employees, we know with small businesses, having someone work 30 or more hours can be difficult a lot of the times. So our full-time employee requirement, they are considered full-time at 26 hours. If you have in place that says, okay, 30 hours or 32 hours is considered full-time and eligible for benefits, that's going to supersede what we have. But this is kind of your guideline. If you have employees that are working 26 hours and you're comfortable with that, offering them group coverage, they will be considered full-time. We have a number of different customer resources as well. There's convenient access to online tools and resources. So once you do become a member, I encourage you to log on to WPS, and you have your ID card with your member number, and you will have access to all of your health information, all of your wellness information, your deductible, how much is met, how much you have to do, how far you have to go, your co-insurance amounts, who's on your plan. There is an extensive library of information on that WPS site that you can utilize. I started playing around with it and I was amazed. You can look at different conditions, different treatments, so much more on there that I do encourage you. And so many people don't use that benefit, and you have all of your information at your fingertips, so use it. We have a prescription drug coverage. Because this is covered as a large group plan, we have a zero copay on select preventative drugs. So your most common drugs, and there's a number of different drugs. We do have a PDF as well that'll be available. on the different drugs that are at no cost to you for high blood pressure, cholesterol, possibly asthma, allergies, and a number of different conditions. So definitely take advantage of that. Preventative services, again, WPS will pay benefits without any cost sharing if care is received in network. That includes your routine immunizations, routine medical exams, including routine diagnostic services, well childcare, mammograms, and preventative screenings. Now, a big question a lot of the times is my colonoscopy going to be preventative? Your first colonoscopy will be preventative, and they're going forward. If they find nothing on your screening, then your next one will be preventative as well. Once they find something that they have to diagnose, then it will be a diagnostic code and it will go to your co-deductible and co-insurance. That's huge. One of the no cost added values that is included with your plan is an exercise rewards program. You will be rewarded each month $30 if you visit a fitness club 10 times or more in that month. It does need to be recorded. So there are tools online, or if your gym has a way of recording that and submit it to WPS. We have an Active and Fit Direct program, and this provides discounts on over 16,000 standard and premium memberships. And again, everything would be online. We do have information available on how to look all of that information up. Something that came about that was huge, especially with the onset of COVID, is your telehealth services from Teladoc. What this is your telemedicine. It gives you 24/7, 365 access to US board certified doctors through the convenience of a phone call, a video, or mobile app visits. It will cover general medical, mental health care, and then also dermatology. Copays will depend on what type of plan that you have, but if you are sick, the last place you want to be is in a doctor's office. You have to get up, you have to get dressed and bundle up, especially if you have a fever, sit in the office, if they even allow you to come in, and wait for your appointment, wait to see the doctor. There's a lot of waiting in that. So telemedicine, if you're on vacation somewhere and you come down with an ear infection, use your Teladoc resources. They will diagnose you. They will call in a prescription to the nearest pharmacy and you can have someone go and pick it up for you. So you don't even have to get out of bed if you feel that bad. Something new for this year that WPS actually added in is the pulmonary care program. This addresses the ongoing asthma and COPD challenges of today. This helps to control asthma and COPD with sensors that actually attach to your inhaler and monitor medication use. You want to make sure that you're not overusing your medications. So it has a propeller inhaler sensor and a propeller app that you can use. We also have included in the plan at no cost an iMed Vision discount program. Provider networks include LensCrafters, Pearl Vision, Target Optical, and many more. Gives you 35% off of your retail price of frames and 15% off of the retail price of contact lenses. Here in America is another free option. You can actually get free hearing screenings each year and up to 70% off of MSRP. Now, how do you get a quote, you ask? I'm glad you asked, because again, you can establish a health plan at any time. We do have a census available that we can provide you. Once we have the census, we quote that out. Normal turnaround time is about 24 hours. Sometimes it's even same day, depending on how late in the day we get that. We will run those preliminary rates for you and get that information over to you with the needed application. Once we receive your medically underwritten application, any waivers for individuals who are not electing the coverage, and a UC 101, which is your state wage and tax that lists out the employees, because WPS needs to establish that you are a true group. We submit all of that with your plan choice to underwriting. Underwriting will review this information, and based on the medical information that has been provided on the applications, they will say, okay, no, it's going to be a standard rate. There's a 0% increase, or there would be an increase of 25%, or what have you, depending on what type of medical conditions and prescription drugs. The cost of the prescription drugs is one of the main factors kind of leading into that. So if you're on drugs that really cost hardly anything, you can look at underwriting being pretty good. Don't quote me on that though, because again, it really depends on if there's underlying issues. And then once underwriting does their final review, they will forward over to myself or Wendy Block the final rates. The final rates are what we will send to you as the employer, along with the employer application. This is the final step in enrolling your group or your business into the WFDA association plan. We would need a completed application, employer application, and then also signatures on the final rates. That's your rate acceptance. Once we get that back, we forward it over to underwriting. They load everything into the system, and then your IDs are mailed out directly to your homes. I want to thank you so much for your time today. I know time is very valuable, and learning about the association plans that we're able to offer. I enjoy speaking about it, obviously. If you have any other questions besides the one that we will address today, definitely give us a call. Shoot us an email. You can go to info@profinsprog.com. Call us at 800-637-4676, or look at our website at insuranceformembers.com for a copy of this presentation. We also do have other presentations on there as well for the other associations, but we do have one on Medicare as well, what you need to know. You can request information from our website as well. We enjoy working with all of our clients, and we look forward to seeing your censuses come in and your phone calls with any questions that you may have. And actually, that ends our presentation. We got about 20 minutes for any type of questioning. So Caroline, if you want to take command, and we can answer questions.
Absolutely. Okay. We don't have too many people here, so if you do want to unmute yourself, you're welcome to ask a question, or you can ask it in the chat box and I will read it to Christine. So we'll give you guys a few minutes to see if we do have any questions. You can also look on our website for more information at wfda.info/health. And I will be posting a copy of this webinar presentation on that site later today as well, if you back and review anything that was discussed.
Yeah, and I know you had mentioned that we can actually write for a 1/1 effective date, and people are like, well, how can you do that? It's already December 8th. We can do that. Once we get applications and all of the required information from the group, we forward it over directly to underwriting as soon as possible. We've had turnaround time within a couple of days to a week. I want to say a week is probably on the long side. And then once we actually get, like I said, that employer app and assigned rates, you're good to go. So just wanted to bring that up. I apologize. I didn't mention that earlier, but we can still do 1/1 effective dates, even though we have a few days off in here for the holidays.
That's great. Christine, and you may have mentioned it, but is it also that you don't have to begin your plan January 1st? Like you could wait until April to sign up or anytime during the year? Is that correct?
That is correct. You can establish, like I said, at any time. So don't feel like you're pressured to do it for 1/1 and try to get everything in. If you currently have group coverage, sometimes we'll try to correspond it with your renewal. But you can do that at any time. Now, if you establish a group plan prior to your renewal date, what will happen is anything that you have satisfied for the current year can be credited to your deductible, which is nice. We can also do, say, you're the only person in the office that needs the coverage. Now, this is a true group plan, so we want to express that it has to be offered to all employees that are eligible. So we just can't have one person from the office saying, okay, well, I want to apply for this, and not offer it to anybody else, because we do need those waivers, and we look at that with the wage and tax. But we can go down to a group size of 1, as long as we have waivers for the other full-time employees. So that is not an issue by any means. And I know a lot of times that's a big issue with the Affordable Care Act, is that you have to have at least 2 individuals to create a group. With our association plan, you only need 1 that is enrolling and 1 that's waiving the coverage.
And then I just want to remind everybody also, it's not required for you to join the association health plan. It's just an added member benefit if you choose to do so. So we think it's really great. I know a lot of you already have your own health plans, but I would encourage you to, at least there's no risk or obligation, to fill out the census and see if you can get a better rate through this plan. I know it's going really well for some of our rural funeral homes who have smaller networks available to them. And, they have small staff. So we're really excited that we're able to offer this. And we thank you guys so much for partnering with us.
Absolutely. We're excited. A huge thing where, especially in the rural areas, a lot of individuals are like, well, what if something happens and I have to go to Mayo Clinic? Mayo Clinic's in network. So that's a huge plus, that you have these wonderful providers in that network. WPS will work with you for the best pricing, so you're not being overcharged by your providers. So yeah, like I said, we're ecstatic that this is coming to fruition and people are starting to take advantage of it, because we're here for you guys.
Wonderful. It looks like we do have a question. Somebody has their hand raised. So if you just want to ask your question, go for it.
I am one of those rural funeral homes you're talking about. We've never had healthcare. It's just been our family for the last 70 years. And we're looking at hiring somebody. And so I'm in that category of one person in a group. How do I start? I guess we've never offered healthcare, never had healthcare, but now we want to offer it to one person from our firm, and I would decline it. We would be the only 2 full-time employees.
Sure. So as long as, like I said, as long as you have 2 full-time employees and one offers or takes the coverage and one declines it, we can offer that. So what we would do is, like I said, go to the insuranceformembers.com or info@profins.com and request a quote. We're more than happy to quote that out for you.
Okay.
We do a lot of 1-person groups.
Now, in you mentioned like December 15th coming up for individual. Our employee won't start until April.
Okay.
Or how does that work exactly? Do I need to apply for the group now, and then when she starts in April, sign her up? How does that work?
If you do not have the 2 full-time employees currently,
Correct.
then you would have to wait
Okay.
until April.
Okay.
The key thing too is with probationary periods, because you're going to elect a probationary period for your new employees. And the least amount of time is the first of the month following 30 days. So if we apply for a group plan, or you apply for a group plan for April 1st, and you hire this individual and she starts April 1st, she would have to satisfy that probationary period that is set by you before she can actually come onto the plan. So that's kind of a hiccup. We do have short-term plans available that we can do from 30 days to almost a whole year. But if we needed coverage, say for 35 days, just to make sure that she gets on the plan after her probationary period is ended, we can do that short-term policy. It's kind of a roundabout way, but they will not add her on unless you satisfy her probationary period first. Kind of a wrinkle, but we do have ways around that. With, like I said, the short term, and the short term is not ACA compliant. So there are a few questions on the application. And then once that can be terminated, that can short-term policy be taken out for longer than 30 days, it can be terminated after that 31st day. So if you start it and it kind of, we want to correspond it with your effective date of your group plan.
Okay.
So I've done that in the past too. So it's a little bit of a workaround, but it's better than not having coverage.
Appreciate that. Thank you.
Absolutely. Thank you for the question. It's a great question.
All right, does anybody else have any questions? Okay, well, you do have the contact information on the screen. You can feel free to contact me as well if you have any questions at office@wfda.info. And we will get your certificates out to you via email shortly. Also, you can email me if you do not receive your certificate, and I'll make sure you get one right away. And thank you so much, Christine, for your time today. We look forward to working with you and wish you a happy holidays.
Thank you. Thank you for all of your time. We appreciate it. We're, happy holidays to all of you as well. All of our information will be on our website as well after the webinar, and just feel free to contact us. Y'all have a wonderful day.
All right, thank you. Goodbye, everyone.
Bye.